Okay, so let me start off by saying that we're going to talk a little bit about some brand new research that just published. And basically, I need a little bit of background for those of you who are not clear about this. There is something called the American Society of Bariatric Surgeons, and they actually changed their name recently, but it used to be, and still known to a lot of people, as the ASBS, which is the American Society of basically weight loss surgeons. And because of a lot of research which showed that in some people's hands, bariatric or weight loss surgery was associated with a pretty high complication rate and pretty bad outcomes. Some 10 years ago, the group of bariatric surgeons decided to create, quote, centers of excellence. They were going to identify hospitals and doctors and put them through a very rigorous process to make sure they met their criteria. And they set them up with all these experts to do Roux-en-Y gastric bypass or lap bands, and they were going to monitor them. And throughout the United States, over the past 10 years, we now have the results of these centers of excellence. And the recent research, they looked at the results of centers of excellence compared to hospitals that did weight loss surgery that were not centers of excellence. And the headline is, bariatric surgery centers don't deliver. And I'm just going to read some of this from Forbes magazine's website. So Tuesday, April 21st, last week, having bariatric surgery at hospitals designated as centers of excellence doesn't reduce a patient's risk of complications or deaths in a recent large United States study. Bariatric surgery is something where you restrict the ability to eat, either with a lap band or the Roux-en-Y gastric bypass. And to be designated as a center of excellence, the American Society of what's called now the Metabolic and Bariatric Surgery has set up some guidelines and criteria, like you have to do at least 100 cases a year and things like that.
What do you mean, excuse me, what do you mean 100 cases a year?
Well, you could be a weight loss surgeon and only do 5 cases a year.
Oh, okay.
5 people come to you out of the year, and you could do weight loss surgery on them, or you could do 100, or in my case, I do close to 500 cases a year.
So you have to do, in order to do this particular one that you're going to do to us, you have to have at least done 100 in a year in order to do somebody.
No. That's for the Center of Excellence for the American Society of Bariatric Surgery, which I am not part of.
Oh.
But I'd like to tell you about their experience first, and then we'll come back and talk about me and our results.
Sorry.
No, that's okay. It's a good question. So we're not talking about me right this minute, although I do like to talk about me, and I will get back to me in a minute.
Okay.
So I apologize. So the Centers of Excellence said you had to do at least 125 cases. There had a bunch of other experts say they needed to do this, they needed to do that, they had to have a nurse, they had to have this. And then this surgeon from the University of Texas Southwestern Medical School in the Department of Veterans Affairs in Dallas analyzed 19,000 patients who had bariatric surgery from a national United States database. And what he found is that overall, the death rate at the centers of excellence was higher and not lower. And the complication rate at the 2 kinds of hospitals was about the same. And the average time spent in the hospital was 2.5 days. So, you all might not get this yet, but what it says is Centers of Excellence for the American Society of Bariatric Surgery know better than those hospitals that weren't Centers of Excellence. And you might then wonder, as your question is, what is Dr. Rutledge's? What are our results for those outcome measures? Our average length of stay is 1 day.
Not overnight?
Well, 24 hours.
Okay.
So average is around 1 day. Our mortality rate at 30 days is 0 for this hospital here.
What do you mean? No one died in just 30 days?
Right. That's how this measure in this study was done. Now, everybody is going to die. And so we have had people die years later after our surgery. But for the first 30 days at this hospital here, we have no deaths at 30 days. And that's what we're comparing to in this particular study.
Okay.
And the complication rate for us here at this hospital is 4.5% compared to their reported rates of 6%.
Say that again, please.
The chance that you will have a complication at our program here is 4% from these national database statistics, and the Centers of Excellence report a complication rate 25% higher at 6%.
Okay, just to reiterate, may I interrupt?
Sure.
My internist, who is, to be nice, a blockbuster, but I love him to death, because he really is for the person. He really cares for the patient. And he said, Judith, don't do this. You don't know how many people, I'm playing devil's advocate. I respectfully ask you this question. I do not want you to do this. You don't know how many people I've had to correct. Don't do this.
Right.
And I said, I'm tired of looking. I don't want to waddle down the aisle to my son's wedding. I have to look good. So,
in other words, what your
speak to that?
Right, your medical doctor was saying that he sees lots of patients who have weight loss surgery who have complications and problems. And that's why the American Society of Bariatric Surgery created the Centers of Excellence to try and improve the outcomes. And what we say to patients who are considering having surgery with us is you should investigate carefully our results. Talk to a dozen of my patients. Talk to 24, talk to 100. If you have the time and effort, you can talk to thousands of people that have made the decision and come and have surgery with me. And most of them are available online, so it's pretty easy to send out thousands of emails, and that then will help you decide whether this is a good idea for you or not.
But I guess what I want to hear from you, and again, I respectfully say this to you,
sure,
because I've heard nothing but wonderful things about you. But I need, like a child, you know, they say a child needs to hear something 77 times before it gets through their thick skull. I want to hear from you, again, respectfully, how many mistakes have you made?
Well, our rate of complications is 4.5% from our data here at the hospital. Now, long term, up to 30% of our patients report when we survey them they've had some kind of complication during the years after surgery. The most common is nausea and vomiting, and usually that's something that's fixable. But you can have serious complications. The most common, occurring in almost 5% of people, is ulcers. And then other complications that you can get are anemia and other problems. So there are a whole series of problems and complications that can occur. So when you consider making this decision, it's something that you're going to want to take a lot of time and effort to think about. Listen to your medical doctor as far as his or her experience, and you won't be able to get a short, simple answer tonight. But this is the beginning of where you're going to start listening and learning about it.
Okay, but that 4.5%, what kind of complications? Were those deaths? What were they?
No, there's no deaths within the first 30 days. That 4.5% complication rate, that's in the hospital here at this center, and it's reported in something called healthgrades.com. And what they did is analyzed our results and compared them to all the other centers in the United States, and we're one of the top centers in the city, in the state, and in the United States and in the world. So we have pretty good results. Now, but I would listen to your medical doctor, because we believe you're correct and he or she is correct. There are a lot of complications from weight loss surgery, and we're pretty happy that most of our patients do quite well. We would say that when we survey our patients over the long term, that most of our patients are doing great, are happy, and are free of complications. But that's more detailed than I wanted to go for this little bit of the video. So I'm going to finish this, and then we can come back to your questions. So, in conclusion, what this research shows is that the effort invested by the American Society of Bariatric Surgery using expert advice to create a better set of hospitals that have lower risk and better outcomes for their bariatric surgery essentially hasn't worked. That as far as we can tell, they're equal to or not quite as good as the other hospitals that are not centers of excellence, and obviously there's more to go. On the other hand, in our analysis of comparing our results to the reported results here, it's flattering to hear that our complication rate, length of stay, and mortality rate is significantly lower than reported in this series. So overall, that's an update. We'll be having more of this report on our website if you want to look into it further, and we'll be talking about it more. And I'll go ahead and stop the video right there for right now, and then we'll talk about some more questions.